50% more concentrated than the inside of the cells should be if the redox potential's up to snuff. So in the test solution, these are good.
Gotcha.
We don't want red blood cells to look like that normally.
Okay. So this is the redox test that you were talking about.
Yeah,
So what's that one up there on the top
just a sideways cell.
Okay.
You're looking at it
from the angle?
from, yeah,
So you're saying this is a good looking test?
pretty good.
What would you see if it wasn't?
We wouldn't see any deforming cells.
They would all
Are
be
the-
perfectly round.
So the ones
so-
that aren't round are more deformed?
Yes, they're more deformed and they have better redox in them. So you've got a good 50-60%. Koch said optimal was 80%, but it's hard to get there with today's exposures.
I wonder if you drank the ASEA and did it again, how much that would change.
Yeah, I asked him, but he said if we have time, so if there's time, yeah.
Gotcha.
That's-
That would be real interesting to see if it,
Yeah, they said within 10 minutes it'll.
Because these are redox signaling molecules stabilized outside of the body, patented process.
could you turn the light off?
Yeah.
Please?
So what's this one?
This is the dark field. Okay. These are red blood cells. They are stacked up a little bit more than we like. They're in rouleau formation.
That's them all stacked together, because
Yeah.
it looks like cords.
It looks like cords, yeah. This is serum of the blood. In the serum of the blood, we're looking for factors that have spiculizations to see if they're there.
That have
That's-
what?
Spicules,
What is
little
that?
thread-like structures. That comes about by some form of chemical provocation in your body.
So we see a little bit of thread things. So
Yeah.
is that what?
That has to do with your body being a little bit lugged down in clearing chemicals.
Is that a lot or a little?
That's moderate.
So
Mild or minimal, moderate, severe with 1 slash, 2 slashes, 3 slashes.
Is it also stacked up a little more because I've used my cell phone today potentially?
Could be.
So ideally, would they not be stacked together at all? They'd be totally
We can
separate.
do a test in just a sec. These little things here are called L forms. That comes about by pathogens trying to get out of the way of the immune system. There are 2 doctrines of medicine, not one. The doctrine we all know about is Pasteur's doctrine, which is a monophasic doctrine. It states that you can do things to pathogens, get rid of them, and restore health. To a certain extent, that's true. That came from France. From Germany came Enderlin's doctrine. Enderlin's doctrine states that you can do things to pathogens, a certain amount of them will die, but then a certain amount of them will shed their cell walls. In shedding their cell walls, they have immune privilege. The immune system can't see it. All the antigenicity, all the ability of a pathogen to evoke the immune system is in the cell wall. This one here, you can sort of see it flashing a little bit. That's a cell wall deficient form. They join up together in L forms and share genetic information and learn how to get past antibiotics, vaccines, the immune system and all. These here, the heavy dots, those are cell wall deficient forms. This is definitely a cell wall deficient form. You can see heavy dots. When a pathogen loses its cell wall, everything gets sucked up into a little spheroid like these. The dots you have a harder time seeing, those are true platelets.
Okay.
Okay. So, yeah, I would say that's moderate spiculization, but it does show some chemical accumulation. This test is indicative of the cytochrome P450 system, the overall detox capacity. This is, can you turn the light on? This is the optimal normal. When there's fragmentations in the pattern, it tells us about the amount of jam up in this system. This is pretty much normal, okay? So that's good.
Yeah, I wonder what this all would have looked like 2 years ago before I started using the Redox.
I don't know.
Well, I guess we'll see how it looks different after the devices.
Yeah.